All right, ladies and gentlemen, good afternoon. Good afternoon and welcome back. We do hope that you have had a productive day in your breakout sessions. We want to hear from the facilitators for a few quick minutes so that the folks who were in the HEAL track can get a little perspective on what happened in the HELP track, and the folks that were in the HELP track can hear about HEAL. So we're going to start with HEAL and Kathy Strain. Where's Kathy? Kathy, come on up, please.
Hi, everybody. Thank you for those that came to the HEAL track. I just want to, before I go into, I don't want to forget somebody left a sweater behind, so I don't want you to go home cold. So your sweater is over here. I have it, and I will give it to you when come get me. But anyway, in our HEAL track, we had an amazing day, I think. I think it went really well. We had about 42 participants in total, maybe 44. And we started out the day, oh, by the way, I'm Kathy Strain with Partnership to End Addiction. I'm a manager of advocacy and peer services, and I've lost several family members to opioid overdose and have been raising the children left behind for about 30 years. So multiple generations. But in our track, we started out the day with an interactive exercise. We did a puzzle, a grief puzzle. We talked about myths. Linda Thompson, here if you want to raise your hand with Partnership. She's one of our grief educators, volunteer coaches. And we walked through an entire session. We did a letter writing activity, which was a little bit difficult. And people had the option to participate or not in that activity. And then we moved on to the Beating Hearts, who are not here because they had another event to get to this evening. So they had to leave to go back to New York. So the Beating Hearts did a wonderful beading activity. Their look up for, I don't know if anybody has their beads, if they want to share them or hold them up, but it was look up for in your loved one's name, dad, mom, or here we go. Here's some beautiful beads here that we created in our group and, our loved one's name. And after the Beating Hearts, Jill Chikowicz, Jill, if you want to raise your hand, Jill is a twin that lost her brother, Scott, and Jill spoke about sibling loss. And after that, Rhonda Miller from Oasis, who lost her son, Ben. Rhonda is also a grief educator, and she shared about her son, Ben, and about finding or companioning the bereaved and how to build your support network. So all in all, we had a wonderful day. There are some handouts on the left side of the blue folder that each of you have, in whether you were in the HEAL or HELP track, that were handouts that Rhonda provided for her session and that we all provided for accessing resources. We know there's not a lot of resources out there for children and for siblings, so we all came together and pulled what we could find for you to bring back to your communities and your families. They're all free resources that were shared. And then Rhonda has 3 activities in there with instructions about building your support network. You can bring that home to work on yourself, or if you have grief support groups in your community that you're a part of, you can share that information there as well. And I believe everybody will get a copy of all of the presentations from today from both tracks. So you can go ahead and look through, and if you have any questions, feel free to reach out to me, and I can connect you with any of the facilitators. So thank you, everybody.
Thank you, Kathy. Next, we're going to hear from Kim Laub from the HELP track. Kim.
Hey, we made the space better today. That's what we did. We got together early on in the HELP section and we started to talk about what we had accomplished in 2024. We actually talked specifically about what were our little wins and what were our big wins. And by the time we got done talking about it, we realized there's no need to differentiate between little wins and big wins, that a win is a win. And we were all making community change and being the resilient warriors that we are. We then began to talk about how not only do we talk about 2024, but set an intention about what do we want to be talking about in 2025 when we return here? What's the story we want to be telling then? But not only just saying what's the story we want to be telling then, getting really intentional about how we're going to tell that story. So we talked about SMART goals, right? How can we really begin to not just say, hey, I want to do something out there, but really say, I want to do effective work out there. Say all the time, we all can be busy. There's a lot to be busy about, but let's shift that busy and start being effective in our work. And so we talked about the importance of setting SMART goals, to walking through methodically what's specific, what's measurable, what's actionable, what's relevant, what's time-bound, and to begin to talk about how we're going to build our programs and our agencies around those SMART goal principles. Then we talked about risk and protective factors. And we did an exercise here that I think many will talk about for a long time to come. That exercise was not just talking about what happened, but looking at how the system has really been conducive for the level of substance misuse that's out there. It began to take a look at risk and protective factors, and it began to validate that there are 4 sides to risk and protective factors. There's the family side, the school side, their community side, and the individual side. And what it left a lot of parents in the room with was an aha moment and a validation that they have done everything that they possibly could do, but substances were in the community. And we didn't have enough protective factors to override all of the risk factors that are out there. And as we continued to talk, we then talked about what resources. Who do we need to bring to the table to have these conversations with us? Who needs to be involved? And how will we begin to choose them? And how will we look at even people who we would never think need to be connected and bring them in and watch them work with us to strengthen the work we did? And then at the end of a day, on a Friday afternoon, after we cried and we worked and we learned and we grew, we said, hey, we want you guys to write down an action plan. I know it was kind of mean of us to do at the end of a Friday. But like every other time, these individuals showed up, even when they were tired and they were exhausted, and they continued to do work when they had nothing left to give. And so they wrote a 3-month action plan. And they talked about what they were going to do, what their SMART goal was. They identified what the SMART goal was. It had numbers and metrics and value to it, and it had a due-by date. And they did their 3-month, and then they did their 6-month. And so I have the ultimate confidence that when we return back here in December or November of 2025, you will hear people share a story about changed community and changed environment. And they did not do that alone, as if everything we do in this world, we do it together. It's the only way we get better. On behalf of Ms. Yvonne, on behalf of CADCA, the organization we got to represent today and we're honored to represent today, we know that our communities are going to get better because you guys got better here today. And so I thank you. It was an honor and a privilege, and I will go back to New York with a full heart. Thanks so much.
Thank you very much, Kim. We want to give our facilitators from both tracks a round of applause. It is now my pleasure to welcome to the microphone Captain Chris Jones. He is the director for the Center for Substance Abuse Prevention at SAMHSA. That's the Substance Abuse Mental Health Services Administration. I hope everybody in this room had a chance to meet and interact with his staff that were out at the SAMHSA booth all day today, right outside in this hallway. Chris, who you may have recalled from a past National Family Summit, has served prior to this at the Center for Disease Control and Prevention in the U.S. Department of Health and Human Services. Please welcome Chris Jones.
Well, thank you very much, Sean, and thank you, Administrator Milgram and DEA colleagues for having me here today. Just to do a little bit of wrap-up in closing, but also to try to help make some connections, in particular for the group that was in this room talking about the prevention work that Kim and Yvonne were doing. I feel like I'm going to be a stand-up comedian. But At SAMHSA, in particular in the Center for Substance Abuse Prevention, we live and breathe that work every day, but we also recognize that we are there to help you all do your work. You are the folks in the community that are creating the change that you want to see. And so I hope as you take those nuggets of the strategic prevention framework, risk and protective factors, taking stock of what's happening in your community, what are the assets, where are the opportunities, how do you connect with those other partners in your community to bring about the change, to raise the story that is so powerful of the experiences that you've been through to catalyze action in your community. Please see us as partners, whether it's funding, training and technical assistance, just the voice of SAMHSA to help raise your voices in communities. That's our job. And I've been in this role for a little over a year, and when I came into the role, that was really the question we wanted to ask ourselves as a center. How do we help you all do your job? How do we help support you and get out of your way from being successful? So at SAMHSA, we have regional offices in all of the, what we call 10 HHS, Health and Human Services regions. They are resources for you to help answer your questions about what funding is coming out, what funding as a nonprofit, as a community organization can I apply to, or help make connections with states that we fund billions of dollars in block grant funding and discretionary grant funding to every state in the US. How can you connect in to those sources of funding to support and grow the work that you're doing? We have training and technical assistance providers. We have the Prevention Technology Transfer Centers. We call them PTTCs because we have acronyms for everything in government. But they are also regionally based. And you don't have to be a SAMHSA grantee to ask them for help. They are there. We give them money to go out and work with people in communities to do prevention work. And we have other resources that, like David, who was our staff person that was manning the resource desk. We have toolkits, we have training materials, all the things you heard on the strategic prevention framework. If you were in this room, that's a SAMHSA approach to prevention. We have resources and toolkits. We have a toolkit for overdose prevention. If you're doing education in communities about naloxone and opioid overdose reversal medications, we have a toolkit that really provides just practical tips and information about how to share life-saving steps that people can take. So please see us as partners in this effort. I have not walked in your shoes, but I have seen this issue from many, many different angles. I'm a person in long-term recovery. I am a parent of an 11-year-old. I am living the anxiety of raising somebody in the day and age that we are living in now. And just like that exercise on risk and protective factors, if you weren't here, the idea is, again, that there are so many things beyond us as parents that we can't control individually. But we can engage in our communities to try to impact those other things. And that's what I try to do in my job and in my personal life every day. And now I understand what my parents felt when they were waiting for that phone call. I had multiple non-fatal overdoses. And at the time, I couldn't connect with it emotionally, but I understand it as a parent. And I think the power of what you all bring to that conversation, the tangible loss, but the fact that you can transform that grief into action and into bettering something that will benefit others more than it may benefit you is what is so remarkable. And it's how do we harness that power? How do we harness that energy to help others in the community who are trying to figure out how can they help? How can they engage and build that coalition, build that community? Tap in to the resources that are already there, but bring new ideas, new innovations, new truths, new experiences to that work, because you are seeing it and living it in real time. And that's something that we also need, that feedback, to inform our work, to make sure that the work that we're doing, the training and technical assistance, the funding that we're putting out is meeting those needs in communities. So for me, it's really humbling to be here and to see the incredible work. And even just to look back a couple of years ago when I participated in the summit, and just to see the level of organization and just the going from sort of nuggets of we want to do things to like this connected community that is really bringing about change and action. And sometimes you may not see it when you're in it, but please note that we see it, that we see the change that you are working to make in your communities. So thank you very much. We can make sure that our information is available, our project officers, our state contacts, our regional contacts, because we really do want you to take advantage of those resources. And I'll just say, a lot of SAMHSA's funding, we have to do what Congress tells us to do. So a lot of our funding goes to states. We don't have a lot of programs that fund smaller community organizations, but many of our states and how we structure that funding requires them to fund community organizations or local governments that then fund organizations in communities. But help us understand how we can write those funding announcements better, and where are we getting in the way of you being able to tap in to some of those resources. So again, thank you very much. I really do appreciate the opportunity just to be here for a few minutes. I love the conversation that was happening in this room. It really makes me excited that you are thinking strategically, intentionally about, again, how to leverage all of that energy into positive action for your communities. So thank you very much.
Thank you, Director Jones. DEA values our partnership with CSAP very much. And to his point of access to all of SAMHSA's materials and information, SAMHSA is one of the founding federal partners on the Together for Families network that the administrator spoke about earlier. Now, for our summit's closing remarks, I'm going to ask you to please help me welcome the Deputy Administrator of DEA, our number 2 for all of DEA's efforts, Special Agent George Papadopoulos. Deputy Administrator Papadopoulos is a career DEA Special Agent, having joined our organization in 1996. He has served in the Detroit Field Division, overseas managing operations in Greece, Macedonia, and Romania, at our Special Operations Division, which you heard talked about last night at the auditorium, and then most recently at DEA headquarters in operations before becoming Deputy Administrator. I should also note with gratitude that he is fresh off an airplane from China. Please welcome Deputy Administrator George Papadopoulos.
Thank you, Sean. Good afternoon, everybody. First, I want to say thank you to Sean for being a great MC as usual, and the staff at the Public Affairs and Community Outreach for DEA for helping put this together. Thank you for that. I also would mention Administrator Milgram, who you heard from earlier and many of you met with today. I could tell you nobody at DEA cares more about this stuff than she does. So thank you for your leadership on that. Before I get to my, well, I do have one criticism of the schedule. You had 3 incredible public speakers speaking before me, and now it's me. So we got to work on that a little bit, because unfortunately, I'm not that good. But before I get to my very brief closing remarks, I wanted to say 2 things came to the administrator's attention today from talking with the conversation she had with you. One is that we need to let you know who your community outreach specialists are in each of your states. So the fastest way to learn that is there's these cards that we have outside that have a QR code. If you go to the QR code and you go under General Publications, there's a section for Community Outreach Specialists by state. But we will also distribute another list. The second thing is on the, we have put together a checklist for local law enforcement on what to do to investigate overdose investigations. We are going to be making a QR code with that information also to get to everybody so that you can pass it along to local law enforcement too. So look out for that in the next couple of weeks. So, okay. I was able to meet with many of you today, but I'm really here to thank all of you for being here. and for sharing your stories, your insights, and perhaps most importantly, thank you for sharing your determination. Yesterday and today were difficult but incredibly important days. In fact, gatherings like this have never been more important. During our first family summit in 2022, we said that the fentanyl crisis was an urgent call to action in our country. By increasing awareness through your communities and by being here today, you have answered that call, so thank you. Many of you came from big cities, some from small towns, to bring attention to the dangers of synthetic drugs like fentanyl and to save lives. So as we bring this year's National Family Summit to a close, we should acknowledge that our collective efforts are working and are making a real impact. We are seeing results, and most importantly, we are saving lives. Last year, as you heard earlier, 7 out of 10 pills that DEA seized contained a potentially deadly dose of fentanyl. That's now down to 5 out of 10. And last month, the CDC released provisional data showing that overdose deaths have decreased for 6 straight months. That means thousands of lives were saved and thousands of families were spared unimaginable pain. So while all of this marks significant progress that should be acknowledged, we must also know that more work remains, and we should reaffirm that we can't and won't slow down now. We know that there will still be heartbreak and hardship, and there will still be families struggling to make sense of this unprecedented crisis, but we are moving forward together. Increased awareness through community action makes a difference every day across our country. As we look to the future, we must continue this critical work. Families and young people across our country are counting on us. They're counting on us to increase awareness and to save lives. They're counting on us to remind everyone, our kids, neighbors, coworkers, everyone, that one pill, one time can kill. They are counting on us to bring this message into schools, homes, workplaces, and communities. The DEA will continue engaging with families and communities through the new Together for Families network and through national and regional family summits, and we hope you all continue to join us in that. So let's keep moving forward together with hope, purpose, and dedication to a safer tomorrow. Thank you for your commitment, your courage, and your compassion, and thank you for answering this call to action.
Thank you, Deputy Administrator Papadopoulos. And as he indicated, in the back, in addition to the small cards, in the back of your program are 2 QR codes. One of those QR codes lists the community outreach specialists by state. The other QR code, I'm going to put in a shameless plug. We would like you to give us an evaluation. We want to hear what you thought of this 3rd annual National Family Summit and offer some insight and suggestions for next year. I'll ask our technical wizards to bring up the Together for Families slide just to remind you of the web address. We want each and every one of you to please sign up to be part of the Together for Families network. And equally importantly, we ask you to go, when you go home, talk to other families, families that may have never come in contact with the regional or national family summits, and invite them to please consider joining to be part of the network. The other item on that screen is an email address. If you have local or state organizations that you feel offer support for families, email us and we will get them added to the network. It is a work in progress and will grow in the months and years ahead. I want to thank Jamila Robinson and Kevin Collins and the entire community outreach and also the Office of Public Affairs team for their work. And we do look forward to having all of you participating in regional family summits in 2025 and a national family summit in 2025. This concludes the 2024 National Family Summit. Thank you all very much for being here. Safe travels home, and we look forward to working with you again. Thank you.